Welcome everybody to GoLocal Live. I'm Josh Fenton, CEO and co-founder. Couple quick updates. Want to thank the folks from Pure Barre who did an unbelievable online class this morning. The 3 instructors for about 30 minutes and a few thousand people joined in the fitness exercise. So want to thank them. At 1 o'clock, Governor Raimondo will have her briefing. Again, she's still not taking questions live or follow-ups in front of Rhode Islanders from news organizations. Do pay attention to some updates coming on GoLocal later this afternoon on some issues that we're working on, and as well as some questions we've got for the Department of Health relative to releasing information about clusters of hotspots within businesses. But let's now go to Dr. Michael Fine. Dr. Fine, thanks so much for joining us.
Good afternoon, Josh. It's good to be here as always.
You got 2 whole days off from not having to Skype in, so I'm sure you're rested and ready to go.
I'd like to tell you they were 2 whole days off, but I had the opportunity to do some thinking and gathering of numbers, so we're ready to go.
Great. Let's go into the numbers first and foremost.
About 900,000 people around the world have recovered. Now 3 million or more people around the world who are tested and positive. We're 989,000 in the United States today. We'll cross 1 million tested positives in the United States by tomorrow. 208,000 deaths around the world, almost 56,000 deaths in the United States. The very nice news, though we have to wait a couple more days to see if it's sustained, is the number of deaths in the United States appear to have dropped off some over the weekend. Understanding that Sunday reporting I'd never find as reliable. In Rhode Island, 7,439 tested positives as of yesterday, 11 new deaths. 310 new cases. That's a drop. But again, I don't know about weekend reporting. I know that the high-risk sites in Providence and in Pawtucket and in Central Falls aren't open on Saturday. And so the Sunday number probably reflects some of that change. And most amazingly, our hospital numbers stay rock solid, are not increasing significantly, and to me that's amazing. And our deaths, though painful, have been pretty stable.
Dr. Fine, there's two areas of the world that are very distinct from the strategies of the United States. One of them is New Zealand, which is an island and has locked itself off from the rest of the world and is now pronouncing that it functionally has no new cases, single digits, and they believe that they've eradicated the disease in the country. So that's one. The second one is Sweden, which has taken on a very different strategy. Sweden has about 10 million people. They have gone for keeping businesses open, schools open, limiting travel within the country, and again, closing its borders, just as New Zealand has. But in Sweden, the number of cases, while rising, is still a fraction of Massachusetts, about 2/3 of what Massachusetts has realized, and has about 2/3 the number of deaths as Massachusetts. They think, their leading epidemiologist is saying that they believe the country will have herd immunity by May of next year. Talk a little bit about what these different strategies mean and what we can learn from them.
Well, I haven't followed Sweden as closely as I've followed New Zealand. And I don't quite understand how they're doing as well as they're doing, though I'm pleased to hear about it, to say the least. As a strategy, trying to get to herd immunity, if you don't get too much disease along the way, is a reasonable strategy. Understanding that when disease becomes widespread, there the risk of excess deaths because you overwhelm the hospital environment. And there's a slim segment of people who need the ICU if they and will survive If they can't get the ICU, we will lose them unnecessarily. And that's who we're most concerned about. And somehow Sweden has avoided that. How Sweden is different from Italy, I'm not quite sure I understand, except insofar as perhaps in the way people live, and I don't know enough about Swedish culture to know that whether in Stockholm, people actually live in enough space and maybe live with enough bathrooms per household and have a small enough household number size that they've avoided the most intense piece. Though I think they have a fairly sizable immigrant community as well. But again, I don't know exactly how they've done it, but good for them that things look like they're going okay. Well, as I mentioned to you, I have heard from a little bit that maybe they're tightening up in a couple of places. We'll have to wait and see over time. New Zealand had the opportunity to do disease elimination. And the good news is it looks like it's successful. They topped out at about 1,500 cases in a nation of 4 million, and I think 13 or 14 deaths. That's kind of amazing. And good for them on the one hand. But on the other hand, the moment they open up to the rest of the world, unless their testing is impeccable, they have the same risk. Now, the opportunity is that everyone who comes to Sweden gets isolated. I'm now thinking for 3 weeks, not 2 weeks, but everybody gets isolated, everybody gets tested, everybody gets
in New Zealand.
In New Zealand.
Yeah.
I mean, that's if they do that and they can control their borders, then they can keep the disease away, at least for a period. And maybe they can do it long enough until there is a vaccine.
Now, in Rhode Island, we have our own New Zealand, right? We
too.
We have Block Island.
We have Block Island, which has, is reported as 0 cases. I'm not sure if that's truly 0 or 0 to 5, but regardless, it works just like New Zealand. As long as no one comes there, and anybody can leave, but as long as no one comes there, their numbers don't change. And if everyone who comes on the island is isolated for 14 to 21 days, or is tested, I think isolation and testing will be absolutely necessary to prevent bringing disease on. They should be okay. But the problem economically is, how do you do that on an island that has built its economy around tourism? That I'm not sure I know the answer.
Yeah, and New Zealand has the same issue. Tourism is one of its leading economic sectors. Block Island, it is the leading and maybe virtually the only economic sector. Block Island is, just 6 weeks away from its season. What does Block Island do in 6 weeks?
I think they're going to have to make some tough choices. The opportunity to do temperature check as people come off the boat, if they can get one of these Abbott machines and test everybody as they come off the boat and turn people away if they're positive, maybe they could get away with it, but it seems kind of risky to me, at least at this point in history. But their alternative is to stay isolated. And then what happens to them economically? That's been kind of the challenge all around. In a certain way, social distancing in a place where there's no disease doesn't help anybody much. Conversely, we see a couple of communities in Rhode Island, particularly our very urban communities, Providence, Central Falls, Pawtucket, where there's lots of disease activity. And some of us wonder whether we haven't been too liberal. That is to say, where we wouldn't benefit by a more intense lockdown for a couple of weeks.